So how do we treat a patient with pulmonary tuberculosis or TB? The most important thing is to give medicines, anti-TB medicines. So now the current guidelines recommend only tablets. So for every person who is diagnosed with active tuberculosis, you give combination of tablets, and this has to be taken for a long duration. The current guidelines say that for a normal tuberculosis, you have to take medicines for at least 6 months for the lung TB. Of these 6 months, the first 2 months is called the intensive phase, where you give 4 different medicines in combination. And in the last 4 months is called the continuation phase or maintenance phase, where you give 3 medicines. So first 2 months 4 medicines and second 4 months 3 medicines. So intensive phase means you try to kill all the active bacteria. So the main disease will be controlled. And in the maintenance phase is mainly to kill the slow growers, or called the dormant bacilli. So this is mainly to prevent TB from coming back. That is called as a TB relapse. So the patient has to complete this 6 months. Only then we can tell that the treatment is completed. But then for a person with tuberculosis, other than taking medicines, it is also important to understand that there are other factors which have to be controlled. One is nutrition. There is a lot of impact on good nutrition. So most of the patients with TB are malnourished. They will have low weight, low appetite, and they would have lost a lot of weight by the time they come to us. So a lot of stress should be put on taking high protein diet and good nutrition. The last thing is correcting the factor which has led to tuberculosis. So many times people with uncontrolled diabetes get tuberculosis. So it is very important for us to control the sugar levels. Otherwise the TB won't get controlled. Similarly, there will be patients who are on immunosuppressive medicines, steroids or some other medicines, and then they develop tuberculosis. So you have to decrease the steroids or immunosuppressants so that the immunity becomes better. Similarly, patients with HIV can develop tuberculosis. So in addition to treating TB, you should also treat HIV and build up the immunity. So whatever is the risk factor, that also has to be corrected. The main treatment is anti-TB medicines. So that is not one tablet, it's a combination of 4 medicines. Second is good nutrition, very, very important. Third is whatever is the risk factor, whatever has led to tuberculosis, that has to be controlled. Once all these 3 are done together, then the person will become better.